My name is Steve Maynard. I'm with WHR Architects in Houston, Texas, and I'm an associate with the firm, and I work in the Sustainable Design Initiative, which is an initiative that was created to promote sustainability within the firm. One of the projects that we've been working on, and I'll be speaking about during the conference, is our in-house product sustainability rating system, which is more or less an online questionnaire that rates materials as they come in that we can specify on our projects to ensure that they're safe for individual use. I hope to gain insight into what's going on in sustainable healthcare and development, which is the aspect I've come to look at, but also just to gain connections with other speakers and other connections here, and also with other healthcare professionals, so that they're aware of the issues at hand in terms of material safety and sustainability at large. I think the value is that we're able to talk about the work that we've done and give a forum for sharing our ideas to get feedback. And I think with the issues of hospital development and this sustainability aspect, which I'm more intimately involved, really requires a lot of different stakeholders. It requires input from hospitals, systems and managers, and from designers, and from environmental regulatory agencies like the EPA. So there's a lot of different components that go into it, and we all have to be really well synthesized, and without this sort of exchange of ideas, that becomes a lot more difficult. I think sustainability and healthcare have been linked on some levels. Obviously, the human health aspects of it have always been very high in terms of the needs of patients, but there's been a lot of obstacles also in terms of a wholly sustainable model because of the types of facilities that are necessary to run hospitals with infection control, 24-hour facilities, the large equipment loads, and also just the demands of space for patients, and some of those things are not necessarily contrary to sustainability, but sometimes typical practice has been not congruent with those things, and so I think there's been somewhat of a recent trend to take those up a level so that the hospitals are actually a lot less energy consumptive, that the materials inside buildings and the indoor environmental quality of buildings are improving, so that they're just safer and cleaner environments for staff and patients. I came in, obviously my first conference, so I didn't know exactly what to expect, but I think it's a very interesting conference in that there's so many different aspects of the medical realm here overlapping. That to me really interests me in terms of how these different factors can overlap and affect each other. Yeah, I have pre-scheduled some networking meetings, and I think it's a good opportunity to get some face-to-face time with people that you might not have just bumped into, particularly with a large number of people at the conference. So I think it is a really valuable aspect to the conference. WHR, my company, we're a full-service architectural firm, mostly based in Houston, Texas, but we have offices in Dallas and in New Jersey. And we have also a sustainable design initiative that's embedded in the firm, and we're looking to continue to improve our process and make our buildings much more sustainable in years to come. We are an AA 2030 challenge adopter, which is we've signed a commitment letter to reduce the energy in our buildings to net zero by the year 2030. So we take that challenge very seriously, and we're working toward those goals.